Greetings and a warm welcome to all the interest present here. I am Swastika from Team Clarnet, serving as allocation assistant to ensure a seamless experience. Clarnet proudly stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for doctors. It is with great pride that Clarnet serves as digital partner for this event hosted by Indian Medical Association Medical Students Network. And the focus of today's session is how to get short-term studentship. Now, I would like to invite Dr. Rohan Arora, sir, to proceed with today's session. Over to you, sir.
Good evening to one and all present in this webinar. I am Rohan Arora, member of the National Standing Committee, IMMSN 2025. I welcome you all to this esteemed event, How to Get Short-Term Studentship, STS, organized by Indian Medical Association Medical Students Network 2025 in collaboration with Department of Health Research under the Ministry of Health and Family Welfare, Government of India. It's an honor for me to start off this webinar with an introduction of our esteemed speakers. I welcome Dr. Tushar Karmarkar, sir, Deputy Secretary, Department of Health Research, MOHF, Government of India. Dr. Jeenu Khan, ma'am, Scientist C, Human Resource Development Scheme, Department of Health Research, MOHFW. And last, but certainly not the least, Dr. Vikas Dikav, sir, Scientist E and Associate Professor, ASC SIR, Center for Evidence for Guidelines, Department of Health Research, MOHFW. We are obliged to have a panel of such amazing and dynamic leaders in the field of academia and medical research with us. Today's webinar will encompass topics like introduction to HRD schemes, research question and protocol development, and administrative issues related to STS, taken by our respective speakers, followed by Q&A rounds. I welcome all the participants to this webinar and with the hope that you live with the motivation and passion for research. I invite our first speaker, Dr. Tushar Karmarkar, sir. Dr. Tushar Karmarkar, sir, is a Deputy Secretary in the Department of Health Research, DHR, Ministry of Health and Family Welfare, Government of India. He is an Indian Information Service IINFOS officer of the 2012 batch. Dr. Karmarkar oversees key areas such as ICMR selection, HRD, Human Resource Development, and GIA, General Institutional Assistance Schemes, PM ABHIM, Center for Evidence-Based Guidelines, and India TB Research Consortium. He plays a vital role in supporting and managing initiatives aimed at strengthening health research infrastructure and human resource development in India, ensuring that medical professionals and researchers receive advanced training and resources to address national health challenges. Over to you, sir.
Thank you, Rohan. Thank you so much for the wonderful introduction. And I welcome all the participants on behalf of Department of Health Research, Ministry of Health and Family Welfare, Government of India. So I am Dr. Tushar Karmarkar. With me, Dr. Dikav, Dr. Saurabh Verma, who is the nodal scientist for the short-term studentship component of our HRD scheme. He is also there with me, along with other officials of the HRD scheme. Before I start, so you might have heard about this Department of Health Research, as you have just started your career in the medical as well as the dental domains. So you may be aware that in the Ministry of Health, there are two departments, Department of Health and Family Welfare, under which there are different program divisions, along with the division which deals with your medical education, as well as some autonomous bodies like National Medical Commission and others. In the Department of Health Research, we provide support to different program divisions of Ministry of Health as well as the private sector and others through promotion of research, conduct of research as well. So the research generation is done by one of our body about which you must have heard, that is Indian Council of Medical Research, ICMR. It has done a seminal work during the COVID times as well as prior to that, and there have been many capacity building initiatives apart from the research grant. It has been giving various fellowships. These fellowships have now, you might have heard about ICMR, STS, short-term studentship, the various GRF fellowships. These all have been now integrated into our component, that is in the Department of Health Research, HRD scheme. So earlier these were isolated schemes of ICMR. Now these are all integrated into the HRD scheme of DHR. So now from here, from Department of Health Research, we are operating. ICMR is facilitating, still continues to facilitate these various components, the various evaluation of the proposals, as well as through other services. We take help of their scientists as well as the expertise of a vast network of ICMR. They are also running various laboratories. We are having the Department of Health Research. We are also having a scheme under which in some of your medical colleges, especially the government medical colleges, you might have heard about or you will hear about the VRDLs, Viral Research and Diagnostic Laboratories have been established. We have established multidisciplinary research units also in different medical colleges, MRUs, which we call. And there are various laboratories like National Institute of Virology or different other laboratories are there, which are research laboratories. These are also being established and are run by DHR and ICMR. So there are other components, but I will now focus on the HRD scheme. I will request Neha to start the presentation, please. So just a broader overview of the HRD scheme. It's a vast scheme of which some of the components might be relevant to you, not all, but you may help us in propagating the other components as well among your colleagues or whoever are interested based on their eligibility. So the calls are right now, the calls are open, and we are going to close these calls on, most of these calls are going to close on 31st of May. So there are just few days left. We are not going to extend these calls. So please be, if you are interested, please submit your proposals well in time. So the first component, which is for undergraduate students, to induct them into the research, to develop an aptitude, to gauge their aptitude in the research, as well as the STS is very good component for exposure to the research. You can establish a cohort at your level also among, and we will also try to institutionalize some of the things about which Dr. Saurabh will also brief you. So first is short-term studentship component. Apart from that, which is for MBBS and BDS students, first and second year students can apply. For the postgraduate students, we are having thesis support program in which we support the publication of some good thesis proposals. There are these MD, MS, MDS, different postgraduate courses thesis. Then for faculties who are regular faculties, for them we are giving fellowships for doing PhDs in the clinical sciences as well as non-clinical sciences also. For those coming from medical and dental background, non-medical, non-dental background, but they are interested in the health research, health related research. For example, health economics is health technology assessment or some of the areas. So for which, for them, we conduct an examination. This is being conducted through National Testing Agency, NTA, JRF examination, in which 500 fellowships are provided each year. For institutions also, we are helping them in human capacity building. They can design the training courses, and we support financially as well as through equipment for designing of the training courses. We help them in conducting of the workshops in the fields related to health technology or biomedical research. For both medical, those coming from medical as well as non-medical background, we provide them the post-PhD research grants. These are called as induction grants or startup grants, to continue their research work in the area which they are inclined to further work in. So for women who have been out of their career because of various reasons like family reasons also, we support them through the fellowships, both for their PhDs as well as post-PhD fellowships are provided to these women scientists. The PIO, OCI, NRIs, those who want to come back to India, we provide very handsome money of 1.2 lakhs per month to them. For up to 5 years, we provide support through PIO research. Apart from this, we give them the fellowship support also. And we are also having, once you complete your graduation, so from post-graduation and further levels, then we are having the short-term and long-term fellowships, international travel grant support for any poster presentations or any if you are going as a speaker in some international workshops, symposiums for that. Also for the regular faculties, we are having the short-term and long-term fellowships for trainings abroad, both abroad as well as in India. So this is the entire spectrum. There are few more schemes like fellowship for achievement in biomedical research in the HRD scheme. But these are some of the well-established components of the HRD scheme. Next slide. So you can see from this slide that we have enhanced the number of fellowships. The total number of fellowships are now more than 4,000. Last year, these were 2,000. So these have almost doubled. And yet we could not utilize our entire funds. So we have enough funds to support even more fellowships if we get more proposals from you. You can see on the right side that the number of seats have also been increased in some of the components, like short-term studentship. There has been double the jump is from 1,000 to 2,000 fellowships are now in. Next. So these are the all components in the single slide, and those which are in the red, for these the calls are presently open. Of these, at serial number 12 and 13, you are having international travel grant, workshop support grant. The calls are open throughout the year. So applications are invited on rolling basis. For the others, there are deadlines. The deadlines are mentioned in the brackets. Next. I would request Dr. Saurabh to speak further in detail to guide you on this short-term studentship.
Good evening, everybody. I am Dr. Saurabh, scientist staff working in HRD division and looking this STS program. So the main aim of this program is to encourage the young mind and young brains, young medical students to conduct research and to understand what is the research. Because once you come out as a doctor after 4 or 5 years, you know what medicine have to be given. But what is the reason behind it? What is the mechanism is working behind that medicine? That if you understand it, then you can become give a good solution and a good treatment and a good drug to the patient. So as far as the seats are concerned, as Dr. Tushar explained, last year it was 1,000 seats and now it is increased to 2,000. So we have a plan to increase the seats, and that will be depend on the funds availability and the number of seats to encourage more and more students. So as of now, there are 80% of the seats are for MBBS students out of these 2,000s. So it comes around 1,600 seats for MBBS students and 400 about BDS students. So as far as the eligibility is concerned, first and second year students are eligible to apply for medical and dental from the medical and dental colleges. Last year we had third year students also, but authorities and competent authority had decided to extend this for the third year students in 2024. But for the call of 2025, it is only for the first and second year students only. So as far as the guide eligibility is concerned, the regular faculty in your medical colleges who is in the same institute to which the student belongs is the eligibility. If the guide you want to choose from any other institute, that won't be allowed. The tenure of the fellowship will be for 6 months in total. It is spreaded into 3 years. So 2 months in each year will be given for all these 3 years. In your summer break, you can do research, or if whatever the time you have throughout that year, you can conduct your whatever the key components of the objectives of your proposal and research. As far as the financial support is concerned, total 60,000 is given to each of the students. And as I told, it is given in the 3 years. So first 15,000 will be given to the at the time of when you submit the concept note. And the next one, second installment of 50,000 will be given at the time when you submit your interim report during the time of second year. And during this time, the interim report should include your key components, your key objectives, whatever the work you have done, whether it may be a lab investigation, maybe a data collection, maybe it sample collection, whatever it may be. So the major portion of your work will be included in this interim report. And the third installment of 30,000 will be given at the end of the third year when you submit your final report, and this final report should be approved by the reviewer. Once it is approved, then the 30,000 will be released for you, and e-certificate will be given to those students whose final research report is approved. The application and the selection process will be totally online. No hard copies or these type of things are allowed or accepted by the department. And whatever your research concept note or the final report will be evaluated by the reviewers, by the team, your field experts, and they give you numbers. On the basis of that, your report is approved. Second slide, please. This is the tentative timeline for STS 2025. You please don't go into much detail of this timeline. Just understand as an overview that in April and May in 2025, when your online application is submitted, your result will be declared in about October 2025, and your first grant will be released in January 2026. So your interim report will be submitted near about February 27, because you would have your exams near about in November, December of 2026. So we are giving you 1 or 2 months extra, so you can do or conduct your research. And in that time period, you can have and prepare your interim report. So your second grant will be released in May near about May 2027. And your the final report submission term will fall near about February 2028. Next slide, please. This component will be taken by Dr. Jinu Khan after a.
So I will just give them the brief because this is specifically for the STS, but just to give you a glimpse of this component. It is similar to STS. We are having the program for support for the postgraduate students also. Don't go into the amounts of financial support that we provide, because it is more of a kind of a certificate that has more value, as well as it is like these STS or the thesis support. These are considered as some of the preferred, I would say, whenever you apply for further careers into the research. So this will always be beneficial for you, because the process is so much competitive. We get a lot of proposals. For STS, we get around 20,000 or even more proposals for these, when the seats were 1,000. Now the seats have been increased. So we are expecting even more as the MBBS as well as BDS seats as well as PG seats are also increasing. So we are keeping it proportionally around 1 to 2% of total MBBS, BDS seats and total PG seats in India. But still, these are very prestigious fellowships. STS is among the most popular programs running since 1970s or so, it seems. So For the postgraduate thesis, we are having this, there is an extended tenure now under the newer guidelines. The PG students, they can apply when they are in the first year, and then they can publish their thesis within next 5 years. So these 3 years, which is written on this slide, is actually 5 years now. The total tenure of the thesis. So next. The young medical faculty PhD, earlier there was one program called Nurturing Clinical Scientist Program of ICMR. Now it has been rechristened, and now it is Young Medical Faculty PhD program. So those faculties having the postgraduate medical degree, we support them to the upper age limit is 45 years, and the research grants are provided to them. So they need not leave their jobs. We also take care of their PhD registrations. If their institutes are not registered under any university for the PhDs, they can conduct their research in association with different ICMR institutes, and we get these. We have got these ICMR institutes accredited through ACSIR. So you will get PhD while working in your own college, wherever you are posted as faculty or as researcher. Next. And this is for your colleagues, friends who are interested in conducting the research, PhDs in the health related fields. Those who are coming like MSc microbiology, biotechnology. So if they are having the postgraduate qualifications and interested in pursuing PhDs in the biomedical sciences, so they can apply. Upper age limit is 35 years for this. Next. So in the BRET or in the biomedical research fellowships, the research or the PhDs can be, you can enroll for PhD under ICMR institutes, which is through ACSIR, or at any other university institute across India, and we provide the fellowships from our side. So monthly stipend is provided as per the UGC norms. Monthly stipend of JRF as well as SRF is provided. Apart from that, HRA and other facilities, some smaller grants are also there, which are given. Next. I am not going into the details, just giving a brief about this is short-term fellowship in abroad, which is for up to 3 months. The regularly employed Indian faculty or researcher is eligible for availing this fellowship. So these are all competitive grants, but here the seats are relatively flexible based on the research proposals we whatever we get, and we select the good proposals for providing them the stipend. US $3,000 is provided per month. These people can continue to get their salaries from their institutes. The airfare for going abroad is also provided by us. Next. Similar to short-term, long-term fellowships are also provided. Last year, we gave around 65 long-term and short-term fellowships to Indian faculties, Indian researchers for getting trained into various universities across the globe. Similarly, we are having the short-term as well as long-term trainings in Indian institutes, but these are not at your level. These are for the regular faculties with at least 3 years of experience. Next. Long-term fellowships at Indian institutes. If some facilities, training facilities are not available at your institute, and if you want to undertake the research into other institutes, these are for such trainings. Women Scientist Program is a very popular program of ours. So these are for both medical as well as non-medical, post-PhD as well as pre-PhD categories. So this is as such, the broader spectrum is there. The eligibility is limited to those having 1 year, those women having at least 1 year of recent career break. And you can see the financial support on the right side, that 90,000 per month and 67,000 plus HRA for non-medical candidates is provided for 3 years of research, and 10 lakhs per month is provided as the research grant. Next. Yeah, next. Then I spoke about this. This is for the Indian diaspora working abroad, but they can conduct research in India in collaboration with Indian institutes, Indian researchers. So they are also supported by DHR. Thanks. International travel grant support. So these are, you can say these are smaller than the short-term fellowships for the, say you are going abroad for some hands-on sessions for delivering any lecture, for the presentations abroad. So this is for those, and this is for the postgraduate levels, postgraduate and above. Next. These are the application selection process. Yeah, these all are available on our website. In the HRD scheme, entire detailed guidelines are there for each scheme component. Next. Workshop funding grant, various workshops keep taking place in different medical as well as health related institutions. So if these are related to health research related areas or health technology or newer areas in the healthcare domain, so we up to 10 lakhs per workshop is provided. Here the institutions, we provide funding to the institutions and they conduct these workshops. Next. These are for designing the training courses, both online training courses as well as offline. So novel training courses can be designed by your institutions. Next. Startup grant support is for those who have done their PhDs within last 5 years, and we provide up to 16 lakhs per year for up to 3 years under the startup grant. So this component has been now revised. These are the revised eligibility and financial support criteria. Earlier, these were limited to our own, those who have been trained through our own fellowships. But now this has been broadened. Any Indian regular faculty or scientist, whether government college, whether private college, any of the regular employee can apply for this. But they should have completed their PhDs. Most of the faculties have done. So thank you. That's from my side. Thank you.
Thank you very much, sir. Thank you very much for your valuable insight and such a detailed explanation of introduction to HRD schemes. Next, I would like to invite Dr. Vikas Dave, sir. Dr. Vikas Dikhav, sir, has, to his credit, more than 150 national and international papers and has also authored several books. Sir has won the best prize in Delhi Neurological Association conference for 3 times in a row for his research work in 2015 to 17. His name features in the world's leading who's who and has been nominated by the British Medical Journal Group to promote academic medicine in 2004. Sir has been nominated as one of the outstanding intellectuals of the 21st century by International Biographical Institute, UK. Sir has also been awarded as Best Medical Author Award 2018 by Federation of Indian Publishers in India, International Center, Delhi. Professor Dikhav works for Ministry of Health and Family Welfare, Government of India as Deputy Director General or Scientist E Medical. Professor Dikhav is currently involved in making clinical guidelines for the Union of India in the Center for Evidence for Guidelines in the Department of Health Research, MOHFW, Government of India. He is also a senior faculty for ACSIR, an institute of national importance, set up by an act of the Parliament. I welcome you, sir. Over to you, sir. Thank you.
Thank you, Rohan, for the nice introduction. It was elaborate, and I thank Dr. Tushar Karmarkar for giving an elaborate introduction to various HRD schemes which are there, conducted and regulated by Department of Health Research. And I also thank my colleague sitting on my left, Dr. Saurabh Verma, who gave an insightful talk about the STS and various components related to STS. So since the theme of this event is how to get an STS, and as Dr. Tushar a while back said that we would all want to have as MBBS or BDS students the STS. So what is the process? But there's no shortcut obviously, and we would want to have the STS, but there's no shortcut. So how should we write our proposal and how should we write our protocol? So in about next 25 to 30 minutes, I'll just briefly tell that, what is the process, and if we adhere to that, our chances of getting the proposal through, they are likely to be much better. So the topic that I'm going to take is what is the research question that we can take, or we can at least deliberate upon various areas, and how do we develop the protocol or the concept note which is required for STS. Although it will not be a detailed protocol, but it will be a concept note that you will require. But the steps are very, very similar. And indeed, if we learn about the protocol, then obviously we learn things right in the beginning that can be carried forward in our careers to come. So let us start. What is a research question? So before we delve into research question, Dr. Saurabh just gave you an idea about what is STS, the short-term studentship given to MBBS, BDS students. Obviously, it's a golden opportunity for students to learn the art of conducting research and how to write scientific paper. At the end of it, when you submit your proposal, obviously, there are going to be some proposals that were very, very good, and people worked upon them, and now they can culminate into good scientific paper also. So that is like icing on the cake. So STS introduces all of you to the world of research, and it gives the hands-on opportunities from writing your own proposal to literature review, and obviously the compilation of the final report. Now, the important thing is why STS is important, because it not only enhances the CV of the students and their guides, but obviously it boosts the career profile of the students, and it is for induction of the students into the field of health research, medical research, right in the beginning of their medical career. Next, please. So what is a research question? Because when you start your career into research, this is the first question that you will come to, or that will confront you, that what area are we going to do research in? Everything has been searched through, a lot of people will say. Some will say, no, not everything has been searched through. There are some areas that you can work upon. Some people will say, yes, there are pressing areas. And some guides will say, yes, there are areas where you can work upon, make a good proposal, pitch in well, and then you can get a good grant like STS. So what are those essential elements that are going to be there in the research question that will help you get a grant? Like if your research question is a focused one, and if it is a concise question, the likelihood of you getting a grant is more. Obviously, the research question basically is the core of a project, and it guides the entire process from literature review to data analysis. So it is the beginning, but then it is just the beginning, but then everything will start flowing with the research question as it addresses a focused issue. The point is, don't do everything in a single project, because you will get 2 months, 2 months, 2 months. 6 months is a short time. But yes, very good quality work can be done in 6 months. A lot of people will say, what can be accomplished in 6 months? Yes, very good quality of research project can be done within 6 months. So that is what we are going to discuss. So when you start doing research, you investigate, you collect data, you analyze, you interpret. But then it all starts with a systematic investigation into a health related subject or a topic. But then your research question should be clear. Many a time there are jumbled up research topics that you just put on, and then think that the grant is going to come. Of course, there are many which are very, very good, but then we are just talking about things in general or average. So your question should be clear and it should be open-ended. That is, it should not be dependent upon what are various options that you can choose from. It should be open-ended. We don't know the answer of it. That is why we are doing research. And it should be potentially answerable through investigation. So that means your research question is like a cop. You're trying to investigate something. And that is why if your research question is clear and open-minded or open-ended, then, it is much better compared to a closed question which you have formulated. Everybody wants to be first when we are students, so be first. And your research question should be focused as we discussed, but it should be feasible also. Like suppose if you want to go to Mount Everest, it may be feasible for some but not for everyone. So the point is, it should be a feasible research question, answerable within the time frame that we have: 6 months, 2 months, 2 months, 2 months. So focused and feasible research question. And of course, it should be interesting also. Because if your question pertains to something that is not a health research priority, or is just some molecular mechanism of a drug which is not so commonly used, of course, that is a research as well. But then, think of a common problem or a common manifestation. As you know, Hutchinson, the celebrated physician used to say, work upon a common problem or work upon a common manifestation of a common problem rather than the uncommon manifestation of a common problem. So that is why we say, like diabetes, work upon diabetic neuropathy, diabetic retinopathy, common problem and common manifestation, or maybe cardiovascular disease and diabetes. So something which is relevant to Indian context, very important. And be specific. Don't say that you will change the neuropathy treatment in 6 months. So the point is that you will do something that is going to be useful for better understanding of diabetic neuropathy, better understanding of diabetic retinopathy, etc., etc. And try to formulate your question in such a way that you're able to answer the question well within the time frame that we have. That is, the time frame that we have is, say, 6 months, that we again and again refer to. But then I said be first. So this B stands for budget. Also factor in the budget or the resources that are going to be required. Because if you don't factor into the budget, then the proposal becomes weak. And all the components of the budget, whatever you require, they should be there. So the point that I'm trying to make, that this budget is obviously relevant for a higher order research. For you, the first is important. That is why I have highlighted the first. This Arjuna story, Mahabharata story, you would all know perhaps that Arjuna was asked to hit the eye of a sparrow that was a wooden sparrow. But then, the other colleagues of his, they said that, we can see a tree, the branch, and he said, I don't even see a sparrow. I see the eye of a sparrow, eye of a wooden sparrow. So that means look at the focused research question as we discussed and identify a broader topic like diabetes, hypertension, mental health, cardiovascular disease, STEMI, for example, stroke. So these are, very, very big, but very common problems. So that is why we say whenever you work upon these broad topics, you will actually talk about how and why. So think about how and why, which are related to very broad topics that we discuss, like diabetes, hypertension, stroke, etc., etc. Now let us take some example. Like, for example, somebody wants to know what percentage of patients with hypertension in your state. For example, you are in Tamil Nadu or you are in Andhra. So you write Andhra Pradesh, you write Telangana, you write Uttar Pradesh, you write Bihar, you write Assam, whatever. So what percentage of patients with hypertension in your state, your district, say for example, Tinsukia district in Assam, Dibrugarh district in Assam, or maybe Gorakhpur in UP, or maybe Bhiwani in Haryana, Rohtak in Haryana, locality, which area do you work in? For example, if you work in, say, Madhuban, Saraswati Nagar in Jodhpur, so you will say what percentage of patients with hypertension in Rajasthan, district Jodhpur, locality, say for example, Madhuban, Saraswati Nagar, remain controlled on medication. Say for example, medication is amlodipine. Now, similarly, you have another example, an exploratory study of factors associated with control of hypertension in your state that you can fill in, remain controlled on medication, say for example, amlodipine. So I have taken two examples. Now I would like to know from you, out of these two examples, that what are the factors? Is the B question, or is it a question, or what are the factors, or you know, the situation in the A question? Obviously in the B we have the factors, and in the A we just have a numerical value, percentage. So which is the research question? And think about it, which is the research question and which is the title here. So I'm just taking a pause for 5 seconds, and then you can think that which is a title and which is a research question here. I have deliberately put over here question mark at the end of each of the lines that I have written, A and B. So you can type in the chat box if you like that which is a title, is A a title or a research question, or B a research question or a title. So only a 5-second pause that you can answer later on as well. But then you can see that there is a research question, what percentage of patients do you want to know what is the perhaps prevalence here? So you would know about the percentage here, and an exploratory study of factors that do these patients exercise a lot? Do they have good diet control? Do they take their medications properly? Do they have their physician referral and follow up properly? So are these 4 factors related to good hypertension control? So that is an exploratory study. So second is a title and first is a research question. So when you start, getting started is something which is really difficult. A lot of people will say, what do you work upon? And how do I work upon? So if you have a piece of paper, write your thoughts that you would want to work upon: hypertension, diabetes, stroke, dementia, Parkinson, multiple sclerosis, amyotrophic lateral sclerosis, cognition, a very broad area, you know, digital detox, which is one area which is coming up, etc., etc. So scribble on the piece of paper, write down your ideas. But then, you know, suppose if you have 5 of you or 6 of you, don't ask your colleagues to include your name in the protocol. It may be an easy way out, but then, you know, try to avoid this. You can develop your own protocol. Each one of you can develop your own protocol. But then, you know, read theories, hypotheses related to the research question that you are trying to develop if you can in your books. Mostly, we generally suggest that, you know, at MBBS level, BDS level, people read books. But if you are smart, if you are motivated, you can go and read journal also in your library, but try to make a mental impression of the entire process which is there. But how would you start scribbling on a piece of paper that will actually lead you to generation of a research question, then your hypothesis, then your protocol or concept note, and then the submission process that Dr. Saurabh told you about. So you can, if you are smart, as we discussed, all of you are smart, but then if you are smarter, you can read case reports, case series, case control studies, cohort studies, or review articles, which are very commonly read, or systematic review and meta-analysis, SRMA, or original research, or pilot studies, hypothesis papers, editorials written by the editors, or the book reviews written by neutral reviewers. So this is something that will give you an idea of good research question. I told you what are the characteristics of a good research question, that it should be clear, open-ended, and it should be potentially answerable by the investigation you are trying to propose. So obviously, not every research question is a good research question. But then what is the criteria to evaluate a research question as a good research question? So we should have a criteria in our mind that what research question is a good research question. Now I devised an acronym to make it easy, to make it look easy. Miner. Miner is the person who excavate the minerals from the earth. So you are trying to excavate the information that you need. That is why you're doing the research. So your research question that you are trying to propose should be measurable. Like for example, prevalence of hypertension, measurable. Prevalence of diabetes, measurable. But of course, these are very big questions. And generally, we don't encourage students to, just go on measuring the prevalence when it is very well known that what is the national prevalence, what is the state prevalence. So rather than doing the exercise that has already been done, we generally call it reinventing the wheel. So you can measure something that has not been done, maybe in the laboratory, maybe in first year you read biochemistry. So measure something, maybe serum homocysteine in patients with stroke, serum homocysteine in patients with dementia. So that will generate some hypothesis out of the work that you're doing. So it should be measurable. And the hypothesis that you generate, say for example, nowadays in sickle cell anemia, people are working towards developing the urinary biomarkers. So maybe urinary biomarker, because we are slowly moving from invasive tests to non-invasive tests. See, not every patient would like to be pricked and then, the blood taken and then test done. And then you would have to inform the doctor that this is the result. If it can be done in saliva, if it can be done in urine, if it can be done in sweat, so why not? So measurable. And since it is something that has not been done earlier, interesting. So it should be interesting. Like for example, if we can measure salivary glucose, just for example, maybe salivary amylase can correlate very well with the control of diabetes, just for example. So it is not only interesting, it is novel also. And if you tell patients that I'm not going to prick you, I'm just going to take your saliva sample, patient would be happy because you're not pricking the patient. And even ethics wise, there would not be any issue because it is not as if we are saying that taking blood is unethical, not at all. Blood related research is done left, right. But then if you can give an option to the patient that I can take urine sample, I can take sweat sample, I can take saliva sample, I can take tear sample, maybe it could lead us to something interesting. And, people who look after the ethical issues, they're also going to be happy. But of course, whatever we do, it should be relevant to the day-to-day care of the patient also. Like if we do research, like for example, generally people say research for the sake of doing research may not be very meaningful, but research for the sake of better patient care is more relevant, more meaningful. So that is what we should be focused upon. And that is why we say, try to answer the day-to-day questions, day-to-day clinical questions that your guide will encounter and your guide will tell you and you discuss. In general, one research done about a decade back had shown that busy clinicians in their OPD, they come across at least one research question that they can answer on day-to-day basis. Now, one research question a day means 30 questions a month, and that means more than 100 a year. So if you sit with your guide and discuss that what are those research questions that you think are answerable in the time frame that I have, and he or she would anyway know what are the research questions that can be answered in the time frame, considering the issues that we have, because it is part of the curriculum. So inducting students into research will become not only easy but become interesting as well. So what we are saying that research question that you thought can be segregated into measurable, interesting, novel, ethical, and relevant. But then one big thing is that we are ICMR, which are DHR. So since we are ICMR, Department of Health Research, so it is important that we actually go through the priorities of a funding agency. And I think this is one mistake that many of us do. Just think for 5 seconds, how many of us have checked what are the national health research priorities which are listed on the website of ICMR? Just for 5 seconds, taking a pause for 5 seconds, and then you just ask yourself that did you check what were the health research priorities that we had, which are the national health research priorities? So you must have thought in 5 seconds, but then look at tuberculosis, which is about to be eliminated, but then what needs to be done? Then we have vector-borne diseases like malaria, antimicrobial resistance, cancer, mental health. Ambulatory care is the wave that is going to come in the time to come, like mobile stroke care, like anemia, childhood malnutrition, acute emergency care, oral health. Primary health care is always very important. So that means if your research question and your concept note is focused upon these areas, your chance of getting a grant is much better rather than focusing on something which may not be immediately relevant. Again, we are not saying that is not a good research. If you have something in your mind that you want to follow, it's perfectly okay. But then if your research focuses upon national health research priority, if you're giving a reference that my work focuses on this research priority, I want to address this research priority. So it goes without saying that, the chances are going to be better because reviewer would want to see what research area, which is a national health research priority, is being addressed by the proposal that has come for review. So protocol is obviously a reflection of a research question, and it is a detailed research plan. And generally people say failing to plan is planning to fail. So if you don't plan well, so it is likely that you may not be able to get a grant. So it's basically a guide for all the researchers who are involved in conducting the research. In that case, it will be you. It would not be a group. It will be you, buck stop with you. But of course, your guide is going to be there. So it should have protocol, consistency, and clarity in execution of the study. Now, it should have obviously protocol should have background information, objective, methodology, ethical consideration, data management plan. We give you a template, but then since we give you a template, so you may not need to remember it, but obviously life is not always about templates, so we should understand what we are doing as well, because otherwise it becomes a artificial intelligence kind of thing that we have a template, we just need to fill the form. Not like that. So what do we write in introduction? What do we write in data? And what is the objective? What is the methodology? What are ethical issues? So this is something that we need to understand and write clearly in the protocol or the concept note. So the protocol or the concept note will have the components like title we discussed, introduction, objectives, material methods, implication or the expected outcome, references, timeline in the form of Gantt chart, and the budget. But obviously for you, it would be more or less the T to T, titles to timelines. Yes, please. So let us focus on title. Many times people, write so many things in the title. The title looks like an abstract. So don't write too many things in the title. Title should be brief. One liner, 1.5 line, 2 lines, 3 lines is quite a lot. Don't make it 5 lines, 6 lines, because then what is the difference between this and the abstract? Because abstract for many journals is 150 words. And if your title itself is 100 words, so what is the difference between two? Minor, so brief, and it should be eye-catching, interesting to look at. Interesting in the sense that it should be, we discussed those COP, that is, it should be clear, focused, and answerable by an investigation. So It should be brief, means it should not be too long, it should not be too short as well. Like 2 line, maybe 1.5 line, 1 line, very good. So introduction should be, because title is the most commonly read part of an article. Like we in newspaper read the headlines, so people read title. Then introduction, it should be concise yet comprehensive, and it should have 3 components. What is it already known about the topic that you are proposing? Like say, if you are proposing diabetic neuropathy, what are the biochemical mechanisms in diabetic neuropathy, or potential biochemical mechanisms in diabetic neuropathy? Whatever is the research question that you have, obviously it will vary from research question to research question, but what is already known? What is something that is standard in the books? What gaps are available? That is, for example, in hypertension control, if we talk about a clinical study. So what may not be very clear is that compliance, even in literate people, is about 40%. So why people don't take medicines properly? What are behavioral issues? What are societal issues? Just for example, and what are peer pressures, or what are psychological issues that lead to poor compliance, and how can we improve? So how can you plug that gap? So 3 things: what is already known, compliance to antihypertensive drug is poor, gaps is that people don't take medicines properly, and you would like to devise a app that will remind people so that they are able to take their medicines properly. You will send a WhatsApp message to them, for example, every morning to take your medicine. Maybe you will ignore that message once, twice, thrice, fourth, fifth time you would like to see, oh, so many messages, I missed my medicine. So just for example, material method should be detailed so that you are able to replicate, and it should have study design, selection criteria, sample size, statistics, etc. And all of you must have played Damshara. So I have just used an acronym Damshara. So for example, if it is your experimental study, not a clinical study, many people will do experimental lab-based study also. So write what is your design, what is the experiment, and what is the detail of the experiment, what are various steps of the experiment, which animal, which breed, which weight, which medicine, which route. So what methods are you going to use? How will you anesthetize the animal? And how will you store the animals? How are the animal care going to be done? And how is the euthanasia of the animal once the experiment is over going to be done? It has to be done humanely. What is the sample? You would not take large number of animals. You will take the smallest required number, and you will again reinstate, rather state the research question again in the beginning, and then you will give all the design and the data analysis plan. So point I'm just trying to make, that you will be detailed. The thumb rule is that your material and methods, they should be replicable. Like if you have written your material and methods, I should be able to understand and replicate at the same time, and write the expected outcome. Don't write exorbitant things that this will change the face of practice. It will not be very good indeed, based on the small study, small sample size. So write within the limitations that you have, what is the expected outcome that we are likely to see. So references in the end, maybe don't write too many references, write about 10, 15, maybe 5, 6, 7, something like that. So Vancouver style, and these articles should be retrievable. So preferably include a PubMed index article, which is easily retrievable. Of course, you can use other databases also, but the point is that it should be retrievable, at least, which is easily retrievable. Vancouver style. Next, please. So if you further want some details, like for example, title can be about 25 words. That would be about a line or a line and a half. Introduction can be 300 words, say. Objective can be about 100 words, and methodology should be detailed. You can see this is what people want to see. An outcome in about 100 words, and references, say 300 words, obviously. So you can go for about, say, 100 words plus, but don't jump from 115 130, 150, 200, 300, 400. So that means stay around 100 and stay around 1,500 words in total, and don't jump too many words, so that whatever is the limit that you have. Luckily now we have a template, so that would not allow you to do that either. Next, please. Indeed, I told about this word limit because Bridget M. Hall, editor of British Medical Journal, about 25 years back, used to say, if you are unable to summarize your work in about 250 words, perhaps you have not worked properly. So that means you should be able to summarize. So before we end, the summary is that many a time people write too many objectives. So don't write too many objectives. These are common mistakes. One main objective, primary objective, maybe two secondary objectives. So that is right, acceptable. But then if you have 3, 4, 5, 9 objectives, there are people who write 20 objectives. So that's not good. You would not be able to achieve that in the time frame that you have. So write about 1 or 2 objective, maybe 1 primary, 1 secondary, and don't make the objective too broad, like safety tolerability of drug X, because it would need a very large sample size. And if you make, say for example, such a title, you have to write what drug, what control, what dose, what route, what frequency, what duration, what mode of administration, like oral versus intravenous or maybe intramuscular, etc., etc. Generally, we do not allow clinical trials for STS. That has to be kept in mind. But then, those clinical endpoint and other things, they need to be kept in mind as well. So one can see very easily that at times we are too focused, like, although this is not relevant to you because it would be you who would be doing things, but then suppose if you are a biochemistry student, that is, as in your guide is a biochemist, but some of the work that requires input from the pathologist. So include sir or madam into the group, and then take his or her inputs, because if you do not have the right cook in the kitchen, then the food is not going to be good. So one thing before we almost finish is sometimes we repeat things. Like suppose if you're doing a clinical study, you will take vitals, pulse, BP, respiratory rate. So you will write the same thing many times in your protocol. Vital signs like pulse, BP, respiratory rate will be monitored, and then they'll be taken 10 minutes after the dose. They will be taken 10 to 20 minutes after each dose, and then they will be taken after each dose. So don't write something that has already been written. And one of the common mistake is that when you don't want to show your work to anyone, you think that, I have done this, so it's enough. So there should be some review, maybe your colleague, maybe your guide's colleague, so he or she can review and then give you useful suggestion. People who are not connected with the study, they can be very good reviewers, because the people who are connected with the review, they may be little biased because everybody likes his or her own work, to put simply. So these are popular books. I wrote them about a decade back. So showing them just because of their popularity among the students, you can refer them if you wish to. And then thank you for listening to me. If you have questions, I would be very happy to answer.
Thank you very much, sir, for such a deep insight and such an elaborate explanation of research question and protocol development. Now, I would like to invite Mr. Rishi Kumar Talrej for the Q&A session.
Good evening to all the dignitaries. I'll be telling questions one by one. So the first question which I'm having, sir, is the data collection period strictly for 2 months? Like few of the students, could they extend it to another month if they want like 3 months to conduct the data collection?
Yes, I think it is fixed at 2 months, and as Dr. Saurav rightly explained in beginning, no extensions are given. So there's no point, dwelling into this. So 2 months should be enough. That is why we said that, take in the plate the amount of food that you can eat. Because if you take more food than you can eat, it will be a waste. So that is why 2 months is the time allotted.
Sure, sir. Thank you. So another doubt what students are having, can they actually have a co-PI during this STS tenure?
No, co-PIs are not allowed because it is basically a student's work. So it would not be allowed. So don't take co-PI.
Because it is a very small project, very small proposal. Not too many investigators are allowed. And we are thinking in the administrative way, and maybe we take out some solution in the further.
Sure, sir. So another doubt what students are having, is there any particular age limit for STS students? Because nowadays many people are lately joining in MBBS. So is there any age barrier for this?
Not to my mind, related to the age, but then, it is very clear that you can go through the guideline and, whatever is permissible as per guidelines, you can see that.
As per the guideline, minimum age is 18 years, maximum age is no limit.
Sure, sir. Uh, so sometimes what happens, students, they are getting a fixed number of words to be written, but can they exceed it if they want for around 40 to 50 words if possible? Because their exact proposals are not created within that word limit.
Rishi, generally people say that, I have the freedom to speak. So that's nice. That is our fundamental right. But then if you are unable to say what you are supposed to say in the word limit that were given to you, so it is likely that you have not conceptualized something in a manner which would appeal to the reviewer. So I would strictly recommend that be within the word limits that was specified.
Sure, sir. We'll definitely try to do it under the word limit count. Uh, so another doubt what students are having uh, is there any chance to extend the STS deadline, unlike other years? Uh, because students are having very short period of time to make the proposal.
So deadlines means you refer to the 2025 call, or in a general broad way you are saying?
Sir, in general.
See, we generally give 1 month time duration, but this year we are giving 15 days more. So I don't think there is chance to extend it.
Yes, and Dr. Tushar just a while back clarified that there would not be any extension. And when we think about extension, Rishi, we tend to become complacent. We do things at last moment. Indeed, it is one of the recommendation from anybody in ICMR and DHR that don't wait for last date. So try to finish 31st is the last date. We still have about 10 days left. So if you have a proposal ready, go to the guide and discuss with him or her, and then present that proposal, and then expedite and submit well before time.
Sure, sir. So another thing what students are asking, whether they can attach two questionnaires for a comparative study in the proposal.
Hey, come again, this one.
Students are asking whether they can attach two questionnaires for a comparative study while uploading the questionnaire format.
It depends on the research question very clearly. If your research question requires two questionnaires, you can do so. You can make a single PDF and then you can attach. Otherwise, if it is a research question that only, say for example, if it is the caregiver burden of patients with chronic illnesses, so it is a single questionnaire. And if it is a caregiver burden and economic burden, it will be two questionnaires. So it depends on the research question that you have.
Okay, sure, sir. So one more thing, they're asking, is it mandatory to attach the case study form or could it be done later?
All the annexures that we ask,
Mandate.
they are mandatory.
Okay, sir. So, sir, that's all from this session. I guess
So nice,
students.
and thank you. What do you?
Thank you, Mr. Rishi, sir, for asking questions put up forward by the participants. Next, now, I would like to invite Dr. Jeenu Khan Ma'am, Scientist C, Human Resource Development Scheme, Department of Health Research, Ministry of Health and Family Welfare. Ma'am is a dynamic scientist and an amazing leader. Ma'am is also the coordinator for ICMR STS, short-term studentship program. We welcome you, ma'am. Over to you, ma'am.
I think Dr. Jeenu is facing network issues. So she is online now. But perhaps if you have some queries, questions, you can go ahead. If she will be online, she will reply. Otherwise, we
Yes,
will
sir.
reply.
In the meantime, we shall put forward the rest of the questions that participants have asked. Over to you, Rishi. Sir.
Sir, yeah, thank you so much, Rohan. So there are a few other questions which students are asking. Shall I proceed?
Madam, आप कर-
Should I start?
नहीं, अरिजीत का नंबर है ना आपके पास? उसको फोन करो कि अनम्यूट नहीं कर पा रही. Yes, please go on.
So students are asking, can they have a guide from another department, even if the study questions does not come under that department?
I think that will be
I-
technically challenging because say if the student is working in pathology and the research question pertains to anatomy, so obviously there will be technical challenges. So it is recommended that the department that you are currently posted in, or maybe the guide you are currently attached to, or maybe the department that you are presently working in. So maybe that is the best kind of combination. But then, since it is a span over 3 summer breaks, so the guide is chosen initially, and then obviously under that guide only you would be working, and that guide would not change in various phases. Like your phase 1 is concept note, your phase 2 is data collection, and your phase 3 is report submission. So in 3 years you will change your departments. Obviously, in first year you will study anatomy, physiology, biochemistry. Second year, as in second prop, you will say perhaps study pharmacology, pathology, microbiology, and forensic medicine. And in final year, you will study maybe ENT, medicine, surgery, etc., etc. So your department will keep on changing, but not your guide.
Okay, sir. So there's a personal doubt again. Like most of the students, you told about first and second year are applicable. What about the students of third year and final years if they have not been into research earlier and they want to try?
Yes.
Actually, before 2024, the third year students were included in the previous years also. In 2024, the authorities taken the decision to include and given the one term extension for third year students. But in 2025, because it is not given, but we because there is always a window for improvement and for the things. there would be some administrative challenges, issues, and the other things we are discussing with the authorities, and we are trying to overcome it.
Okay, sir. Some major of the students who want to pursue their uh, study in clinical branches, like for the first year and second year students, they are not actually have been posted. They are not going mostly to their clinical postings as they. So they haven't seen actual the clinical branches and they want to do those kind of research. So how are they going to proceed in it? Few of the students might have that doubt.
I know, Rishi, it is always a catch-22 situation because when an MBBS student goes from one department to the other, he or she starts liking the other department. So that is how and why we all evolve as clinicians. But then, when it comes to a student who's working, say, for example, working as an is studying in, say, second year and is a pharmacology pathology student, but would want to do something in clinics. So he or she can very well do that because from third year onwards the clinical postings are anyway going to be started. So it depends on the understanding between the guide and the student. So this is clear that if the guide so feels that this is the kind of interaction that I would want to have with the student, and this is the research question that I would want to give to the student, and it is acceptable to the student, then it can be worked that way.
No, sir. Thank you for addressing that. Sir, again, one another doubt what we're having is students are saying, is it okay to do a health economic study since the guidelines state biomedical research? Is health economic study considered a part of biomedical research by ICMR?
Interesting question. See, health economics and biomedical research are related. They are very much related, but then, doing a health economic study at MBBS level 6 months could be quite challenging because health economics understanding will take a lot of time. And here the idea is to train the student in the research process right in the beginning, the process of research. So 6 months is again, split into 2 months, 2 months, 2 months. So basically, it would be advisable if the student works on the topics which are related to MBBS, like we discussed anatomy, physiology, biochemistry, pharma, patho, forensic medicine, um, something like that, so that the student is able to get loads from these subjects and topics. And indeed, these are massive in themselves. So when you have a total of 19 subjects from which you can choose your research question from, your research topics from. So why to jump to health economics? Of course, that is important, that is relevant. But then since the scope is related to biomedical research, so I would suggest that, confine yourself to biomedical research.
Okay, sir. So another doubt is that many students are not professional with the statistics part. So how are they going to include it in the proposal?
Two things. Now we have started a national helpline, which is a national biostatistical helpline that has been started in association with NIMS. And about 30 scientists from ICMR, they are contributing their time to the National Biostatistical Helpline. So you can search through the net, and then you can pose your queries there. That is one. The second thing is that almost all medical colleges, institutes for sure, they do have biostatistician. So of course you can go and talk to them that this is the proposal that I have. But the recommendation always is that before you start your research, you talk to the statistician, not after that, because after that it becomes sort of a post-mortem. So it goes without saying that do it well before you start your research. So it is doable, and of course, we understand that MBBS student is not expected to know a lot of statistics. So take help, and that is when we actually learn the art of taking help from a statistician, because statistician will ask some questions. That what is your research question? What is your population? What is your sampling frame? What is your research design? What is the sampling method that you're going to use? and where are the patients going to come from? What is your sampling strategy? So all these things will come into play, and then he or she will calculate the sample size. But obviously, calculating sample size statistically may be very large, so only a part of it can be taken in the STS. So that depends on the understanding between the student and the guide.
Sure, sir. Thank you for addressing that. So one of the students is asking, uh, is IC approval a necessity before submitting ICMR research protocol? Can they use any affidavit as a substitute as of now?
That you have at least submitted your proposal to the ethics committee, you can submit that undertaking that it has been submitted. That is minimally necessary. That you will take ethics approval. So at least submission is something that is something which is required
And that undertaking should be signed through proper channel
to proper channel.
by guide and head of the department.
Please.
Ethical
So,
is compulsory, submission of first annual report. It is compulsory. Time of submission of first year annual report.
At the time of submission of the report, obviously, if your project was not ethically approved, so how can you submit your final report? So goes without saying, and indeed, it goes without saying even otherwise, before you enroll your first patient, you should have ethics approval. That is a gross rule of thumb, that before you enroll your first patient into the research, so ethics approval is required, because we don't know what are ethical issues related to that project. Only the ethics committee is going to be in a position to tell you that what are ethical issues, and they will ask certain questions that guide is supposed to respond to.
okay. Thank you, sir. Sir, this is a personal question again. Like I have also tried for STS, but unfortunately didn't get selected. So students are asking whether if they are giving the proposal and it doesn't get selected or it is getting rejected this year, so can they at least know all the mistakes that they have done in the proposal so that they can not repeat it again in future?
I think this is a policy question, obviously, and a lot of people have asked this question. So I think it is under review, this question itself, because as Dr. Tushar said, that we get about 20,000 proposals. So giving reasons of rejection to everyone is very difficult, and that too, the STS that we give is about 2,000. So 18,000 people will have to be said no to. But that does not mean they are not good. They may be good. They may be very good. But then, as we discussed, there is a format, and there are national health research priorities that are linked. If this is something that we said, this is not necessary that your proposal fits into the national health research priorities. But if it does, it improves your chances. And if you follow all the guidelines, as in, there is a format and you fill everything properly, your research question is concise, clear, and focused, and your aim objectives are clear, and your project is feasible, and it is novel, it is interesting. So there is a good likelihood that you will get STS. But then since you tried, that itself is wonderful. But my personal suggestion to people who have not gotten, they should not be disheartened at all, because it is part of the learning experience. Say if you did not get, at least you tried. That is number one. Number two, you learned the art of writing a concept note, and you learned the art of submitting a proposal to a national agency. So that itself is an achievement in itself, that you sent your proposal for consideration to a national agency. Who knows, once, twice, thrice, we may be lucky sometimes. And that is how we, learn to do things, because at times what so happens is, like, we may not be selected in MBBS in our first attempt. We may be lucky in second attempt, we may be lucky in third attempt. So it is about attempting, but not giving up. Giving up is not good. Attempting is always wonderful.
Even after STS, you have an opportunity to submit your proposals and projects when you have become PDF, or when you are applying for some positions.
Yes, absolutely. And indeed,
Yes.
that's why Dr. Tushar just a while back, enumerated all the scheme. What if you did not get STS? You have second chance at MDMS. So who knows, in MD you can get, and you may get a PDF, postdoctoral fellowship. Maybe you may get a travel grant through ICMR, DHR to go abroad for some training. So we should not be disheartened at all. All of you are very important component of India's healthcare system. Or you are potential doctors. So that means disheartening is the last thing that should come to our mind.
This is it. So there a student was asking, can we use multiple statistical analysis like ANOVA regression analysis in a single study?
Yeah, of course, it can be done, but then what is the general recommendation is that we keep things simple, because if we keep things complicated, then it becomes difficult, because a regression may not be understood very well by MBBS student right in the beginning. So we generally suggest that there is a gross rule of thumb here also, that if your research question can be answered by simple statistical techniques, do not use complicated statistics. This is also a rule of thumb, that if simple things can do, why use complex? Like if paired t-test can work, unpaired t-test, if ANOVA can work, why go for regression? But of course, if it is required, it must be done. There's no doubt about it. But it should only be the thing that we understand very well, and we are able to put, everything in the form of a compiled report, so that we are able to justify the inclusion of a test that we had chosen for explanation of a research question.
Okay. Thank you so much, sir, for addressing these issues.
Yes, I think we can
that's-
now try if Dr. Gino is online.
Yes. That's all, sir, from our side. Thank you so much, sir.
Yes, Dr. Gino, are you online?
Hello, sir, am I audible?
Yes, very much, very much. I think she is
Okay,
right there.
thank you so much, and my apologies for joining so late. I had some other meeting which was unavoidable, and I just got free some 15 minutes before, and therefore I'm bound to join through my phone. So the network is a bit erratic, but whatever I heard during my joining of all these few minutes, I've already seen that the HRD team over there, Dr. Saurabh and the team there, have very well answered, and Dr. Vikas itself have answered all the administrative issues regarding the STS and other programs. So I think that most of it is cleared, but still, if there is any doubt or any specific another queries, I'll be happy to answer. If my network is with me, so on the phone. But I've already seen that many of the queries which are most common with the STS students and applicants have already been answered. So still, if there are any queries, I'll be most happy to answer them.
Correct, correct. Dr. Gino, I guess you are very right. Firstly, we welcome you, and you were traveling, you had a meeting, so that is why you could not join. So we understand that. But I think out of your experience of handling STS over the years, if you can summarize some of the difficulties that students face, common difficulties, and possible remedies. So I think that will set the stage for students to come up with their questions.
Sure.
So,
Sure, sir.
common difficulties and remedies.
Sure. So what is my past experience since 2017 until date? That many of the proposals, they are good, and they are planned so well, but just because the students do not follow some administrative guidelines and terms and conditions which are very well clearly stated on the website and everywhere, and we remind them timely about that, the proposals does not get through the scrutiny process. It gets rejected over there only because you're not following the complete guidelines. And the most common of it is like not attaching the exact documents. You miss the documents. You are attaching something else in the place of proposal. You are attaching instead of IEC, you are attaching some other document. So these are all the issues. And now one of the issues also that if you don't get the ethics committee approval, but still you have a chance to upload an undertaking from your bride, that whenever the ethics committee meeting will be scheduled, you will submit the ethics committee approval to us. You have to just upload a simple undertaking on your behalf and your bride's behalf. And that you can attach in the ethics section, which most of the students are not doing. And so incomplete application and misplace of documents, not attaching the correct document, or not following the guidelines. There is one more major thing, that there should be no identifying information, because STS follows an unbiased review. It is a blinded, unbiased review. So now, if your identifying information is present in the proposal itself, which is clearly stated that it should not be, but the proposals have those identifying information, so the proposals get rejected. So there are many such small things which happen with the STS students. In spite of there being a very good proposal, because of the administrative issues, your proposal doesn't get through the scrutiny process as such. So it's better that you all read the guidelines very carefully, and most probably the 2024 से guidelines revised हुई हैं. So I always encourage everyone to please go through the revised guidelines, and if you have any queries regarding those guidelines, then do write to us. The team always answers. There is an email ID dedicated to the STS, and Dr. Saurabh and the current team is currently addressing all the queries on time and everything on time. It is very well now structured. Apart from being only online, even the queries are addressed. So that is why please read the guidelines and then apply. Simply just that the call is out there and you just start submitting and do your registration. Please don't do that, because you'll not know what is to be done. Then your proposal will not get through the scrutiny process as such. Leave apart the review. And ethics is, yes, required. Dr. Vikas already clearly told that any research involving humans and animals, any component of that has to go through ethics approval, and you need a ethics committee approval before starting that research work. So if your study has that component and your ethics committee meeting is still not done, then please upload an undertaking in that place. We accept that undertaking, and do not write anything just with the proposal itself. Your proposal is a different document itself. It should not have any other document attached to it. Even your undertaking can be attached in the ethics part, where the ethics document is asked, but not with the proposal. So these are the some very little administrative issues and things and guidelines that you all need to follow, which I have experienced, because many of the proposals get rejected because of this only. I have seen this. They are very good, but they don't get through the scrutiny process because they don't follow the guidelines. And as you all be knowing that being a funding agency, it is our utmost priority to first follow the set of the guidelines which has been set by the competent authority, and then move ahead with the review of the proposals. So I please urge every one of you to please go through the guidelines, read them very carefully, every terms and conditions listed, and then prepare your proposal in consultation with your guide. Now, some of you are asking that we are not from the statistics field. Of course, you all are from the medical field. So you can add a co-supervisor from the statistics field who can help you with the statistics part of your study. They can be added as a co-supervisor, though ICMR does not recognize co-supervisor in the STS program. It is only the supervisor, that is guide, is recognized. But still, it is a part of some big project. So you can always add co-supervisors in your project. And those co-supervisors can be from the statistics field who will help you with the statistics part in your STS research work. So, and in the gradual process, you will also learn through your co-supervisor and mentor. So that's all what I have to contribute and my experience throughout this past 5 to 6 years with the SCS program. And rest all I think has been answered. But still, if you all have, please do feel free to write to us, the team and everyone will address. Thank you, everyone.
Dr. Gino, thank you very much. In your short talk, you summarized one of the problem with the several proposal is guidelines were not followed, or at times when annexures were supposed to be attached, so there may not have been annexures, or if they were, then instead of IEC, then something else was attached, and people did not review the revised guidelines, or they were unable to talk to statistician right in the beginning, as we discussed. So that created statistical confusion, and obviously that can cloud the validity of the project itself. So keep all these 5 things in mind, obviously, and then we can take some more questions. They had come. Rishi, if you can read through some questions, so we can take up.
Yes, sir. There are a few other questions as well. Students are very enthusiastic this time. So,
Yes.
one of the student is asking, what is the correct pathway to change the guide post proposal selection in case our current guide has to leave the institute?
In
So
that
yeah,
case,
Rishi, in that case, your institute will have to assign a new guide. Okay. The medical college itself will assign a new guide to the student as per the proposal which was accepted by ICMR. Okay. The proposal which was accepted by DHR ICMR and the student was selected. So that proposal will not change. So accordingly, a guide in that subject expertise from the same college will have to be assigned by the college itself. And you can just inform us via email that my guide has been changed and give the reason that why the guide has been changed. And that's all. You can inform us through the email and we'll update the change of the guide in our records also. So that is the follow. Your institute will have to deal with it. We have no say. You need not take any approvals from us. Only that your proposal will not change. Even if your guide changes, your proposal, what has been approved by DHR ICMR, that won't change. So your new guide has to be from the same subject expertise of what your topic was selected and approved by DHR ICMR.
Yes,
Okay.
and at times, what happens is, suppose if there was a student who got lucky in a medical college, got the project, and STS was awarded, the guide was very happy, student was very happy, but the guide left the job and joined some other institute. So would the now student move along with the guide? The answer is no. Would the project move along with the guide and it is allotted to new student? No. So
No.
same from the same institution, same area of expertise, the guide will have to be allotted, and obviously you write email to the
Yeah, via email you can inform the SPS team on the email ID given that your guide has been changed and specifically the reason should be mentioned and that letter should be forwarded to your new guide and your dean or director or whosoever is the highest competent authority of your medical college. It should be forwarded through proper channel.
Okay. Ji ma'am.
one
Thank you so
more
much.
thing, Rishi. One more thing, Rishi, that we have prepared FAQs which are available on the website, and most of the queries which you are asking here, we have covered these 70 to 80% of the queries and their answers, which are already available on the DHR website. And perhaps the students are not visiting to the DHR website and not reading that FAQs. I think that will solve their problem.
that you can see, and several questions may get answered.
So, so one of the student is again asking about if they are having a secondary element in the STS proposal included in the methodology, but it's not part of the stated objective. Would it be acceptable to exclude it during the implementation and final reporting, or could that be also led to review issues?
I think it goes without saying, Rishi, that whatever you had stated, that it is like a promise. When you make an objective, it is like a promise that you will do this. So obviously, not every promise is fulfilled, but it goes without saying that excluding certain objective which was not met and then doing an analysis may not be ethical. So that is why we say that you don't take too many objectives. So that was the first thing that we discussed. So take one objective, two objective, one is primary, one is secondary, or maybe two secondary, one primary. So don't include too many. And while you're doing the analysis, then if your objectives were not met, so you write a detailed justification. But then it goes without saying, I think let us address the root cause rather than encouraging it. May keep one objective, plain and simple, so that you're able to focus and you're able to do what was required.
Sure, sir. So, what kind of study are mostly likely to be selected? A case control, a cross sectional, or a retrospective kind of study?
I wish it was a PG MCQ or a PMT pre-medical test MCQ, but it is not, because Rishi, it depends upon the reviewers' acumen, reviewers' perception, and there are obviously criteria which are laid by the competent authorities, which are mentioned in the guidelines. So it is an amalgamation of a lot of things. So it depends, to my mind, speaking personally, on the appropriateness of the research question, and how it aligns with the health problems that we have in the country, because we are a national body. So saying that yes, case control is likely to be awarded better or cohort is likely to be better awarded would not be appropriate, because each study design has its own plus, own minus, own unique strength and limitation. So we would not be able to say that, one research design is preferred in ICMR vis-a-vis others. All designs are viewed neutrally. So they are reviewed neutrally, and it is the recommendation of the review committee. So that actually leads to the award.
Yes, sir. Sir, is there any official cutoff for plagiarism in the STS proposal?
Maybe Dr. Gino, if you would like to answer that, is there a cutoff?
Yes, sir. No, sir, there is no cutoff as such, but you should always check there are many free plagiarism softwares available, and you can please check whenever you prepare the draft of your proposal that is approved by your guide, please check it through those plagiarism softwares and see what is the minimum cutoff that particular software gives you, that plagiarism should be of 10% or 6% or 20%, whatever is the cutoff that plagiarism software is stating, the standard one, please follow that. If your proposal is showing a plagiarism of what the standard cutoff that particular software is showing, then please you will have to remove it and revise it again. Don't submit it as such, because plagiarism is something very important that we all need to be very vigilant, and don't plagiarize, don't copy from your seniors or previous reports. You can always have the chance of reframing and rewriting in your own words and taking the review of literature which is available on PubMed and Scopus only. Do not take any review of literature from just Google and just randomly quote it and write it. So that's how you can check the plagiarism. There is no cutoff as such we have stated for STS.
I think very well answered, Rishi. But two more things I would want to add. There are guidelines of ICMR, that is research integrity and publication ethics. So these guidelines, they are applicable to the scientists and also people who conduct, big time research. And generally, the minimum cutoff is it should be below 10%. But then, for STS, since it is a induction of the student into the research methodology, we do not encourage, the bottom line is do not encourage any sort of plagiarism. Another thing that I would like to tell is that, there is nowadays that GPT kind of thing, or, AI kind of thing, that you go on Google, create AI documents. So that should not be done, because it is like, encouraging the intellectuality inside the medical doctor. So today's medical student is tomorrow's medical doctor. So we strongly encourage everyone to conceptualize and then think aloud within yourself, and don't use unfair means like plagiarism, or as Dr. Gino mentioned, taking documents from Google in the review. That would weaken the proposal. So that should not be done. And I'm sure each one of you is capable of writing a very good proposal, provided the guidance is good, interest is there, and the adequate amount of time is devoted.
Yes. Thank you, ma'am. Thank you, sir. Sir, in KP-based survey study,
And I would to like to add one more thing over here, Rishi. That as sir said that now Chat GPT and many AI tools are available, so you just put your topic over there, and it gives you a very fancy kind of data about what is available on the literature. But I tell you that even if you do that and you think that nobody will come to know, here the experts sitting here and reviewing your proposal, we instantly come to know that it is a Chat GPT generated matter. So even if you generate, please don't do that first of all. But if you still do, I'm telling you that proposal will be able to identify in one go itself that it is a Chat GPT generated proposal. So please avoid such things.
Ji, ma'am. So, ma'am, another question is, in KP-based survey study, do we have to attach questionnaires form along with the submission of proposal itself?
See, if you are using any standard questionnaire which is already in place and you're referring to that and you have planned your study according to that particular standard questionnaire, then you have to attach. But if it is something that you are going to plan the survey, a pilot study, and then you are going to devise a questionnaire yourself, and it will be only after some pilot work has been done on that, then there is no need of compulsion, because these things are already optional given. It is not mandatory. So if your study, you can state in the reason in the methodology that the questionnaire will be devised and it is under process and it will be made and keep in consideration the standard format. So you can write that in the methodology and there is no need to of then attaching it if you're devising it on your own or it is as per the study required. But if you are referring to any standard questionnaire of WHO or whichever body it is or whichever disease or whichever topic it is, then you have to attach that questionnaire for sure.
Ji, ma'am. Ma'am, one more thing is like about PubMed. People, students are asking whether the PubMed they have topics which are very well aligned with the objectives in many area. Should that person still go with it as it is not very much relevant in his region?
Yeah, you will always have to find the context that why do you want to do it. Okay, if that study is already done, suppose if there is a study which has been done in northern India, okay, but on PubMed you find no articles which have been reported in southern India, and you are a medical college located in southern India, then of course you can do that in context that no study has been reported in southern India on this particular disease or this particular aspect, and you want to explore it, considering that there has been cases reported from northern India, from central India, or whatever you find on PubMed as per the review of literature. And the review of literature should always be recent. Please suppose that you are now submitting an STS proposal in 2025. So go only for the PubMed data, which is like 5 to 10 years, not beyond 10 years. What will be the context of a study which is 10 years done earlier, and now after 10 years, many scenario and many things have been changed. Many new explorations have been done on that subject or particular topic. So prefer to take the most recent and most evident review of literature, and if you find that in your region that particular thing has not been explored, then you can surely go for it based on giving the reference of the existing review of literature.
Ji, ma'am. Ma'am, only few questions left. One of them is there any standard format of case study form or the students have to form it by themselves?
No, case study form C, it will be as per your study. It as per the topic that you choose. Your case will define your case study form. Whatever cases and whatever study you choosing, there is not any particular format for case study form. So you will have to devise it. If you are planning something new to explore, then you will have to prepare it on your own in consultation with your guide. But as I told, if it is something again something standard which is already in place and you want to compare something on your questionnaire or your survey, then that case study form standard one has to be attached, and you will have to prepare as per your cases.
Okay, ma'am. So in many of the colleges, what happens is the students have to submit all the original documents. So while uploading in the STS uh, site, on the STS site, it's asked that we have to submit our 10th mark sheet or the 12th mark sheet. So can they just upload the Xerox copy? Is it possible?
Yeah, you will upload the Xerox only, no? And the scan upload online आप और क्या upload करोगे? आप उसको scan करके ही तो copy upload करोगे. जो आपका document आपके पास है, उसको आप करोगे. वो तब तक था जब तक कि online ये वाला provision नहीं था. बट अब तो ऑनलाइन है तो आपको Xerox कॉपी ही स्कैन करके ही अपलोड करना है.
Okay, ma'am. Ma'am, a few of the studies, for example, if anybody wants to study about HbA1c related, so it's gonna take already like 3 months, and they are not having that much of time. So, are they going to get any kind of extension, या फिर any kind of additional period for the study?
See, I think it hardly matters if you're doing it in 2 months or 3 months. 1 month में what difference will it make? So अगर ऐसी कोई study है जिसमें आपको 2 months से ज्यादा लग भी रहे हैं, so I think that very well you in consultation with your guide can manage that timeline and manage that time and try to complete it. And if it is still कि आपको वो 1 month बिल्कुल भी extra नहीं मिलेगा college से,
जी मैम.
then try
Making a
to
diary.
put only objectives which require 3 to 4 months. You can do the study on HB1AC, but you try to put some objectives which you think that are feasible to be completed in 2 to 3 months. Timeline तो आप guide के साथ करके आप काम कैसे भी कर सकते.
जी मैम.
I think sticking to the timeline is very important. So that is also, one good way of doing ethical research. That is, we stick on to the time, and maybe this is part of the training, sticking on to time, not taking extra time.
जी सर. Sir, mostly what happens matlab in some cases students want to study it during a particular time period, for example during the rainy season or during the winters, but we are not having that the period for the STS project. For example, I wanted to do it during the rainy season. I wanted to see something related to um, upper UITIs. So if in these cases, how the students have to approach if they are not getting during the time frame during which they want to do the project?
This is a gut feeling that Rishi students have. Like, for example, if you want to see, childhood malaria during the raining season, the incidence, just for example, incidence of childhood malaria or malaria in pregnancy during the rainy season in a particular locality. So obviously you can do, but then choosing a topic is an enterprise for STS between the guide and the student. So you will have to speak to a guide and then, discuss that this is what I would want to do, and of course then see the comfort that you have, that is the kind of time that you have available with you, and the kind of resources that it needs, that if you could do everything that you would want to do in the time frame that you had. So it depends on several things, but of course it is always better to discuss everything that you have in your mind with your guide.
Thank you so much, sir. Sir, all the questions have been done. Uh, Thank you so much for addressing it.
Thank you so much. It was wonderful. And, we hope that people utilize this information to submit very good proposals. So I firstly, on behalf of Department of Health Research, thank everyone who has joined. And I thank you, Dr. Tushar, who had, briefed all of you about the schemes that Department of Health Research has, including STS, which was were briefed in detail by my colleague, Dr. Saurabh, and my colleague, Dr. Gino, had, made up time despite, her being traveling from one place to the other this evening. So we thank you, everyone, and we thank IMA as well for being forthright in organizing this timely. And then, you can have your words from your side. So over to you.
Good evening, everyone. I am Dr. Suryam Singh, the National Convener of IMA MSN. On behalf of our entire team of Indian Medical Students, Indian Medical Association Medical Students Network, I would like to first and forward thank the speakers for today, Dr. Tushar Karmarkar, Dr. Jinu Khan, and Dr. Vikas Vikav, for taking the time out and sharing with us their valuable insight on this webinar, and for also answering all the questions very patiently, taking your time out and answering individual questions with all the details necessary. I would also like to thank our presenters, Dr. Rishi Kumar Dalreja from Delhi and Dr. Rohan Arora from Haryana, for taking this meeting and webinar and organizing it very peacefully and very beautifully. I would also like to thank Dr. Arjit Bansal sir, the immediate past national convener of IMSN, for giving us this opportunity to contact the Ministry of Health and Family Welfare and Department of Human Research for organizing this conference, this webinar for the same. With that, I would like to propose the formal vote of thanks, and thank you so much for the entire team to join us today, and all the students who have participated and made this webinar a success. Thank you so much, sir, and thank you, ma'am, and thank you to the entire team at the Department of Human Research. With that, I would like to call this webinar off, and thank you so much again, once again, for everyone to join this webinar. Thank you.
Just to thank our colleagues who have sat, in the evening hours, the department colleagues and, the support staff. So thank you, everyone. And, the passion that students had shown to ask questions after questions. So that shows a lot of interest in STS. Keep it up. Thank you.
Thank you so much, sir. We are looking forward to more such collaborations in the future. And thank you so much once again to everyone involved and the entire team. Thank you so much, and have a very good night.
Thank you.
So thank you so much, everyone. Thanks to all the delegates. With everyone's permission, we are signing off for today. Thank you.